2, 1, 0. Okay. Hi, everyone. Welcome to Hmong Woman Now. Today I have Susan here with me. I'm super excited because today we have a student who knows about the career in pharmacy. So I'm very excited for that. Before we go on, I just want to apologize to our viewers, because I know that we have viewers that are from different parts of the world that actually tune in. And so I have had people who asked me for us to speak in Hmong, but I apologize. The reason why we are not speaking in Hmong, it's not because we don't know how, it's not because we don't want to, but it's because our Hmong, well, probably my Hmong, it's not 100% accurate. So if I were to speak in Hmong to the guests and the guests were to reply in Hmong, we might not be able to tell you guys exactly what we want to in Hmong. That's just me, but Susan, do you agree? Or would you be able to explain to us in Hmong everything?
There might be some portions where I'm not, or like some words that I won't be able to perfectly translate in Hmong. So I agree. I think that it might be better to just keep it in English for now, and hopefully in the future we could, go into speaking instead. Yeah.
Yep. Okay. And yeah, with that being said, if you guys ever do watch it and it's in English and you have any question, you are more than welcome to ask us a question, and then, in the comments, and then we'll get back to you, and we'll write back to you in Hmong, and we'll try to explain us, the best that we can. Okay. But okay, so we're going to go ahead and get started with the interview. I'm going to introduce Susan a little bit, and then I'm going to ask her some interview questions. And then as always, our viewers, your questions will follow at the very end. Okay. So I have here with me Susan. I already said that, Susan Her. Susan was born here in Fresno. She was born here, and then when she graduated from high school, she went to UC Berkeley, where she received her BA in Integrative Biology with a focus in human biology and health sciences. Right now, she lives in Stockton, California. She lives there because right now she's pursuing, she's actually going to a school, the pharmacy school, where I'm not exactly sure. So I'm not exactly sure what's the outcome of that. So in a bit, we'll ask Susan if she can tell us all about it. Okay, so with that being said, I'm going to give this time for Susan to tell us a little bit just about herself. So go for it, Susan.
Okay, so my name is Susan Her, and as Linda said, I was born and raised in Fresno, California. After graduating from high school, I attended UC Berkeley, where I got my BA in Integrative Biology. And then after Berkeley, I decided to go back home to Fresno, and for 2.5 years, I worked in a lab as a research chemist. And so I did a little bit of research for a fertilizing company called Actogro. But then during that same time, I was also finishing up my prereqs for pharmacy school. And then I also used that time to apply to pharmacy school. And so, I am now in Stockton. I am attending the Thomas J. Long School of Pharmacy and Health Sciences at the University of the Pacific. And I'm a first-year pharmacy student, but it's a 2 and 9 months program. And so I'm like almost halfway there. But yeah,
that's exciting.
A little bit about me. Yeah.
Okay, awesome. All right, so the first question I'm going to ask you, because I mentioned earlier, because I said you're attending a pharmacy school right now. So tell us a little bit, after you complete the School of Pharmacy, what does it do for you? So does it certify you to become a pharmacist? What does it do for you to complete, for completing pharmacy school?
Yeah, so when you complete pharmacy school, you will receive your PharmD degree. And so that's like equivalent to a doctor's degree. Yeah. And then that will allow you to consult with your patients about their medications. You could also work and give advice to like physicians, like the doctors, and like work together on deciding what is the best treatment plan for a patient. And I mean, like the field of pharmacy is very broad. Like there's a lot that you could do with a pharmacy degree. And so it just really depends on what you want to do and like where you want to go. That program is, so this program in particular is 2 years of your didactic courses, which is courses like your classroom courses. And so you're taking all those courses in 2 years, and then you have the 9 months where you're doing rotations, which is kind of like a hands-on. You're actually working as if you were a pharmacist. And this will take place in like the different like pharmacies. So there, like I'm sure you all have seen like there's pharmacies in CVS, Walgreens, Walmart, but there's also pharmacies in like the hospital or like the convalescent homes. As a pharmacy student, you have to complete those rotations as well before you could get your pharmacy degree. Yeah.
Oh, okay. That makes so much more sense for me now. Although I'm not pursuing a career in pharmacy, that makes a lot of sense because I never really knew what it was. So it kind of, to me, it's kind of like those people who goes into the doctor field where they do their residency, kind of like that, right?
Yeah.
Okay,
so
that's awesome.
For pharmacy, we have been like kind of going towards that route too. So after pharmacy school, you could also pursue a residency. Yeah, and so that's So if you, for example, if you want to work in a hospital, it's preferred for you to have a residency. And so we have you can either do 1 year, which is like more like a general. You're kind of like learning about like the general. How do I say it? You'll be working in a hospital too, but then you'll be like working in all the different departments in the hospital and just kind of getting like an overview of like what a pharmacist does. And then your second year, you would like choose something more to like focus in on, and then that's where your specialty will be at. Yeah.
Okay, that's very interesting. Thank you. Okay, so the next question I'm going to ask you this question because when I was completing my undergrad, I feel like my undergrad was not something that was not necessary for me to become a teacher. And so with that being said, the question I want to ask you is that, not very many people are aware of what pathway they should follow in order to, eventually go to pharmacy school. So for the undergrad, for your undergrad, you receive a degree in integrative biology. I know some people who received their degree in chemistry. Mm-hmm. And so with that being said, how has your degree prepared you for pharmacy school?
Yeah, so my degree, I think my degree did a really good job of preparing me for pharmacy school because in integrative biology, we had to take chemistry courses as well as bio courses. And so even though the main focus was more on bio, like we do a lot of bio in pharmacy school as well because it's, like the human body. When you're taking drugs, you also have to think about like what the drug does to the body. And so that I honestly think that my major did a good job of preparing me for pharm school, but you don't necessarily need to major in bio or like chemistry to go into pharmacy school. You could do, I don't know, like a major in English and still like go into pharmacy school as long as as long as you do all the prereqs for pharmacy school. And so those prereqs consist of all the science courses. So like your chem courses or your bio courses. On top of that, you have to do like the anatomy and the physiology. And so as long as you have those prereqs done, you could apply to a pharmacy school.
Okay, so then would you recommend though that even though they could take English, right, and then still go into pharmacy, would you recommend that they still focus on a particular pathway instead? And so for example, like chemistry or your integrative biology, so that they would be fully prepared? Because I asked that because I'm gonna talk a little bit about how mine was, like liberal studies to become a teacher. And again, I feel like liberal studies is, for me, it's a no-go. Don't do it. For me, I feel like, they could do English and still become a teacher. And I would recommend that instead because you at least have, in-depth knowledge about English, psychology, or whatever, and still apply that to being a teacher. So with that being said, with pharmacy, do you think that it's okay, that they do their English degree and then go into pharmacy? Or it's best that if they really want to be successful, it's best that they focus on a specific science topic that will eventually help them to be successful in pharmacy?
To be honest, because there's so many, like there's a lot of prereqs that a student have to take to actually be able to apply for pharmacy school. I think that with those prereqs that are necessary already, you'll have a good foundation on like going into pharmacy school. Yeah, so you could still take another major, because you have like, if you're gonna do another major and you also doing your prereqs, you'll definitely still have the foundation that you need to, or the basic knowledge that you need to go into pharmacy school and still succeed. Being in pharmacy school too, we teach you things, so you're still learning as well, even if you have forgotten. Because that's how I felt going in. You know, like I was out of school for like 2.5 years. A lot of the things that I knew in undergrad, like I kind of had forgotten already. And so being in pharmacy school, like you get the opportunity to learn it again. And so I honestly think like the prereqs is all that you need to have a good foundation. You could definitely focus in on a major to have like a more in-depth knowledge. And yeah, I'm sure that will definitely give you like the upper hand, but it's not necessary for me. At least that's just my opinion. Yeah.
Okay, I think that's something really good to know, because you know, sometimes like you know, we go into college and we don't really know anything because we don't have somebody up, you know, higher who can help us. And so we sometimes go into the wrong field. We waste a lot of time, right? And so I think it's really good to know. So for example, if I was passionate about being a teacher, right, I could still do teaching. And if I was passionate about teaching and pharmacy, I could still end up doing both, right?
Yes.
That's really good to know. Okay. All right. So the next question I'm going to ask you is, explain how you determined which pharmacy school was right for you.
Okay. So UOP has actually been at the top of my list for as long as I can remember. Well, like when I decided.
Sorry, keep on going, Susan. I'm going to walk out real quick.
Oh, okay. That's okay.
Keep on going.
Yeah. So UOP has always been the top of my list because it was close to home. But then, like, as I finished my undergrad, I've started to really think about it because, you know, I was also considering like UCSF, UCSD, and I just, you know, how I narrowed it down to UOP was that I thought about like what kind of pharmacist I wanted to be, and I really wanted to be a pharmacist that's like in the community, I guess. And so UOP is actually known for like their mini health fairs that they put on in the fall, and those health fairs, like I've attended them as an undergrad, and that was, you know, just being there and like seeing what they do, what the students do. It's just like, I don't know, it was just like a calling, like I was like meant to be there. And so the 3-year program also was like a, you know, like it was kind of like a cherry on the top of the ice cream, the sundae, you know, because you're done earlier. However, you know, like there is a con to UOP. It is a private school, so it is going to cost a bit more. But if you think about it, you are done a year earlier, and so that means that you're able to work a year earlier, and you know that kind of just like makes up for how much you're spending for your tuition being at UOP. And so yeah, that's my reason for UOP.
Oh, okay. So just to clarify, because I kind of stepped out real quick, you said you attended a conference, or what was it?
It was a health fair. So UOP put on a lot of health fairs throughout the year, mainly in the fall. And so one of the health fair that I attended was what we call a Medicare health fair. And what happens at the Medicare health fair is that we provide like mini health screenings. And so people of the community are able to just come in and like get their screenings done. And the thing about pharmacists is that we can't, we don't diagnose patients, but then we can tell them that they are at risk of like having hypertension or having like diabetes. So they should contact their doctor as soon as possible and like get a checkup. And so we provide those services for the community, and that's what I really love. You know, we're actually able to like go out there and like show our faces, talk to our patients, you know, see what's going on in the community, and like, yeah, like I just feel like coming from a underserved community too, like that's something that I'm really passionate about, and just being able to be a part of that, like I was really inclined to go to UOP just so I could like also do that and, you know, like serve the underserved communities as well.
Okay, so since you mentioned that you attended a health fair, right? How did you get that? How did you get that information? How did you get that piece of information? Did you go and research? Did you talk to, you know, somebody that you knew?
Yeah. So the reason why I knew of the health fair as an undergrad at UC Berkeley was because I joined the pharmacy club at UC Berkeley.
Okay.
And so that's another thing that I would suggest like a student to do, because, you know, like I feel like that is where you can learn the most, and learn the most about like the field of pharmacy, as well as like ask your questions if you had any. But being in that club, we had a lot of guest speakers, and so the students of UOP actually attended and presented their health fairs to us. And so it gave us undergrads an opportunity to just go and see how what the school does, what happens at a health fair, what pharmacist does. And yeah, like I thought it was a great opportunity to just you know, get a foot in and see how it's really like to be a pharmacist, and then see if you like it. And that was kind of like, yeah, that was where I just fell in love too.
Okay, all right, that's really good to know. That's really good to know, because you know, I never really attended anything. I never really reached out for resources. So I think that's really good to know, you know, go ahead and attend a fair. I think that's really good. My next question for you is, because you did mention that you're attending a private school, so that makes it more expensive, although you finished a year earlier, correct? Yes. So then my next question for you is, if others should be concerned about financial aid or scholarships or loans for attending pharmacy school, whether it's private or not, what would you recommend for them to do in order for them to, you know, continue that?
So I come from a low income family too, so I know the struggles. Money is always an issue. I think that money should never be the reason why you're not pursuing a higher education. You have to see it as a investment in yourself. You know, so for grad school, there is a lot of scholarships that you could apply for, and it does help a lot. However, I know that a lot of people do have to turn to loans. And I know that when it comes to loans, it's a bit scary, but just, again, you know, think of it as an investment in yourself. You know, if you are very passionate and you are committed to, you know, like bettering yourself, getting a higher education, don't let that be the reason why you're not attending, you know, college. You're not trying to go somewhere better. You know, there's also part-time work. You know, I know with like college, they have like the work study, which is also there for resources, so to help you a little bit. Of course, it's not going to be able to like pay off your tuition, but it will kind of help. It will help a little bit with your financial situation, but also do not let it overcome your studies, because you are a student first. And so always keep that in mind. I think with the loans, it's just that really think about it first, you know, think about your commitment, and like see if you are really passionate and committed to finishing the program, because you are taking out a big chunk of money, and you will have to pay it back. And so the advice that I always give people is to really think about it. If you know to yourself that you are going to, you know, go through with it, like if money wasn't an issue, you're going to go through with it, and then I say go for it. You know, like take out that loan. Don't be afraid to, you know, like don't be afraid, and don't let money be the reason why you're stopping yourself in your tracks.
Okay. I'm going to ask you another question about loans. Some students have a maybe it's a misconception or maybe it's, actually true that you can only take loans out for a certain amount. So for example, in your undergrad, if you take it out, and then for, your master's, you take it out, and then for your doctors, you won't qualify it anymore. Is that true? Or what do you think?
So there is a maximum amount. I don't quite recall like the amount, but I know there is a maximum amount for the loans that comes from the federal loans. However, if you need more than that, there is still private loans that you can get for school. It's just that those private loans has higher interest rates, and so a lot of people.
So the private loans, go ahead.
So a lot of
private
people
loans like through. Sorry, I just need to get out there. So the private loans are like through bankings, like banks and stuff like that, like EECU or stuff like that. Okay.
Yeah, so those are private loans, but then like the federal loans, there's a max to it. At the moment, I am able to take out those federal loans. So even in your doctoral like degree, like you're able to take out those federal loans, but there is a max, and so to be honest though, like even at the max, like I have enough to pay for like all my bills as well as my tuition, and so I wouldn't worry so much about it. And then again, like if anything, you still have the private loans, and again, it's just an investment in yourself. So just always like keep that in mind.
If let's say we have a student who wants to attend pharmacy school, but they probably don't qualify for loans and they're in the process of applying for scholarships, what would you recommend? So like if they were planning to pay out of their own pocket, what amount would you recommend to start saving to get to when they start pharmacy school?
Okay, so pharmacy school is again, like it's the tuition is different for every place. Being at a public school is a lot cheaper than a private school, but then I'm not like I don't think that you will be able to save like for your tuition, and so that's why I rather you not have to worry about it at all and just pull out those loans, because those loans so those loans you are able to pay back after you finish your school, and by that time you should be able to have a good paying job that will help with paying those loans. And just talking to like a lot of pharmacists, like they've told me themselves saying that like they make enough to still live decently and be able to pay off their loans. And so again, like don't worry about the money issue. About saving, like it's always good to start saving, but then the tuition, I don't want to say any numbers to like scare anybody off, but it is pretty high. It is pretty high, and like to be able to pay it off with your own money, like it's a lot of money. It is a lot of money too, and that's why I say you should think about like your commitment to the field and like the school. So always think about that before pulling out a loan. And then, I think that you should just, when it comes to like financial issues, you should just go with the loans and not have to worry about it, because once you're done with the school, you're gonna have a good paying job that will, will allow you to pay back your loans as well as like let you live decently too.
Okay, I'm glad that you said that. I guess I just want to add a little bit to what you said, that I do agree, because have loan forgiveness too, so that's good. For certain careers you do get loan forgiveness, so like you said, invest, you apply to all those available resources, and then probably they forgive you for the loan. But okay, so let's move on to the next question. So the next question I have for you is, explain what you hope to accomplish in the future with your profession and your knowledge.
Well, okay, so like I mentioned it a little bit ago, like my goal is to come back to Fresno and like serve the underserved communities, the underrepresented communities, and particularly the Hmong population. I think there's still so much educating to do, especially in the field of medicine, just because, we're known for like the herbal medicine and like the medicine from like out of country. And though I'm not saying that their medicine is better or like the Western medicine is better, I want to educate on like the safety of taking medicine, like,
Yes, yes.
yeah, because,
Oh my goodness.
we go to the Hmong celebration and there's like a lot of vendors that sell medicines, but then a lot of times they're packaged and like, there's like 5 different tablets in one package and we have no idea where those meds comes from and like what the side effects are, or like, I just really want to come back and educate the Hmong population and like other uneducated communities about the dangerous, like the dangerous of like taking random medications. And the reason why, even though a lot of like our older Hmong folks like disagree, or like they kind of shy from like taking Western medicine, it's just, I just feel, I don't know, I feel almost like I want to just tell them that these medicines are studied, they're studied, they've been researched, and like they are effective. Maybe yours is effective as well, but then because they haven't been studied, like we don't know what the side effects are, and I perhaps like it might interact with like another like a drug that you're taking, or like they might even worsen like another chronic disease that you might have. And so just like those kind of like issues, like I want to come back and just have a dialogue one day, perhaps like go on to Hmong TV and like do an educational on just medicine. And so I'm also hoping to kind of bring back the health fairs that occurs in like Stockton in the Northern California. I'm also hoping that we could start having that in Fresno too. And so this will just provide, the underserved communities with free services that, like should be available for them.
Yeah. I love that you mentioned that, because I think that's like main purpose for what you're doing. I think that's great, because it's true what you said. We have all these like medicine that come from overseas, and without being able to read those labels, but as long as our parents hear the other Hmong person say, oh, it's going to do that for you, then they trust that immediately. They're not to offend anybody out there, but a lot of the old folks are very hard-headed, where they they don't want to try anything new, obviously out of fear, right? But I love that, because that you're going to do that, because then maybe you can speak to them and get them to believe you. But then I thought of a question in my head. So with that being said, with them being like extremely hard-headed, how do you plan to like get it to them, like through their heads? Because like there are people out there who maybe are already pharmacists, and they're probably at that point where I don't care anymore, right? So it's like, if you choose not to care, you choose not to care. So they may when the old folks go to the pharmacist, they might be like, okay, I just wrote you a Tylenol, take it home, kind of like that, right? And then they kind of just take it home. So how do you plan to talk to them, be patient about it, and get it through their heads, and not be kind of like, okay, I give up? Like, how do you plan to get through them?
That is one challenge that I still need to like think about too. But you mentioned it, like just being patient and just keep iterating it to them, just so like they know. I think that even if like I agree. Even now, like I come across that issue with my parents as well. Like they even being in pharmacy school, like it's hard because like they're so used to just taking the meds and listening to other folks, and so it's just being patient. And I think that I'm going to have to still think about it and see how I could relay the message. But I think just persistence and being patient, and just keep telling them that these are some of the things that you should consider when you're taking other meds, and like even alternative meds too, because it isn't researched, like there's not a lot of studies done, and so it's just persistence, and I think I would just still have to like think about how I'm gonna go about it.
Yeah, I would agree with you though, being patient, because I know that a lot of old folks, when they go to the doctor and when they see like, a Hmong person there, they feel relief, and I think they especially love when the Hmong person starts to speak to them very gently, like speak to them in a really gentle tone instead of being, where like, just do it. And so that's it. Yeah, patience is really good. That's a start. Patience is a start.
Yes.
Yeah. Okay. So for the next question that I do have for you, I'm going to ask you to identify resources, ideas, or any strategies that you've discovered, along the way that you believe will be extremely helpful to those who aspire to follow your footsteps.
So, resources, they're the people around you. Like, I feel like even though this person, like even if this person isn't going into pharmacy, you could always still learn something from them. For example, like you being a teacher, like maybe just like, oh, where do you get, how do you apply for the loans that you taken out of school? Like, you could ask people, like those are general questions for anyone who is like pursuing a higher education. And just like the internet too, like we're very lucky to be born in an era that like there's the internet, like there's the web, like you can just look anything up online now. And so I challenge people to just like go on the internet and be like, how do I get into pharmacy school? Or what are the prereqs for pharmacy school? Oh, one more note. So for prereqs, it also varies between schools. So again, whichever pharmacy school you want to go to, look that pharmacy school up. Like, go through their website. Like that's where you're gonna find all your that's where you're going to get all your questions answered, basically. And
can I just cut you real quick, Susan? So prereqs available, while they're doing their undergrad. So for example, if they're doing chemistry, because it's chemistry, it's not pharmacy, right? So does it tell them that these are the prereqs for pharmacy, or should they go to the pharmacy school to look at the prereqs and then take those classes?
Yeah, so they're going to actually have to go to the pharmacy school and get the prereqs there. Yeah, because when you go to like an undergrad, when you're doing your undergrad, like there's so many students going to so many different fields, and just chemistry courses isn't just for those who are going into pharmacy. There are also people who wants to go into research, who are chem majors, or like those who are going to med school. Like there's so many people, there's so many other students that are like taking it too. So I don't think, if they do tell you that it's a prereq for pharm school, that's amazing, but then most likely it won't. And so you would have to go to the pharmacy school website itself and see if that class is covered under one of the prereqs.
Okay, so would you recommend, for example, if I were to be like an English student who's passionate about English and passionate about pharmacy, so would you recommend for someone like me to take my English classes, if that's what I want to do, and then, look at the pharmacy school look for the pharmacy school that I want to attend, look at their prerequisites, and then take the classes along with my English courses? Would you recommend that?
Yeah,
okay,
I would recommend that.
So then when I graduate with my English degree, I could still enter into pharmacy school because I've completed the prereqs, right? Okay. Yeah. So if somebody completed their chemistry with the misconception that just because I have a chem degree, I could get into pharm school, right?
No.
That's a misconception, right?
That's a misconception.
Okay. All right. That's good to know. Okay. That's good to know. Hopefully, some people who I know who are, majoring in chem, hoping to go into pharmacy, hopefully they will get this message and start looking for the pharm school, right?
Yeah.
Okay.
So you always have to just look at the prereqs and see if you fulfilled all of them. I know, like, for example, when you compare North State to like UOP, North State might not need you to take public speaking. They might require you to take another semester of like general chem, so like just those kind of stuff, like, and so like it just varies between like pharmacy school, and it also varies on it also varies with like the exams too. So like for pharmacy and like California, this might change, but then like when I was applying, we didn't have to take the PCAT, which is like an exam for pharmacy school. However,
So
there's other state. Oh, so
is it to enter pharmacy school?
Yeah. So some school requires you to have that score, and they require you to take the PCAT. However, California schools didn't require that, but outside of California did. So again, like it just depends on which pharmacy school that you decide to go on, like go to or want to go to. You should look at their prereqs and make a list of all the classes you need, and then like get those classes done, and then you could be you're able to apply to the pharmacy school.
Okay. So did you learn about this early on when you first, went to college with the idea that, okay, I want to, become a pharmacist? Did you learn early on that I need to, look up the prereqs, or did you later find out I need to catch up with my prereqs?
So I learned about these prereqs being in undergrad. So I didn't have any idea too. Like I went in, I was like, I want to be a pharmacist, and like I thought the same thing. I'm gonna major in chemistry. Yeah. And then I started off as a chem major, and then I realized from a friend, like she was the one that like kind of helped me with like knowing that like she was the one that taught me that for pharm school you have to take these certain prereqs. And then when I was like comparing the classes between my majors and the prereqs for pharm school, I noticed that I was missing a lot of classes from the prereqs. And so in my mind, like I was just like, okay, so you can't just major in chemistry and then be able to go into pharmacy school. You actually have to take these classes. And so I switched major, because my major, the integrative biology major, it allowed me to take a lot more of those prereqs courses. And so I was kind of like killing two birds with one stone, like I was getting a BA as well as getting all my prereqs done for pharmacy. Yeah.
How early on did you switch your career? I mean, your major, how early on? Was it like your first, second, or?
It was after my first semester. It was after my first semester. Oh, okay. That's when I switched over to integrative biology.
Okay, so then we would recommend that the fourth year college student who is a chemistry major to stay with chemistry, right?
Yes. Stay with chemistry because you're already almost done, but then just look into the prereqs because you will have to take those on the side. And so like I mentioned in my introduction, I didn't finish my prereqs after Berkeley. So I was still doing prereqs even outside of yeah, but it was only one course. It was only one course, but even within my major, it didn't fulfill all the prereqs for pharm school. And so that's so you always just kind of have to like see and try to fit everything in, basically.
Yeah, okay. And so would you recommend to seek academic counseling so like they could draw out that pathway for you so you'll have all the courses necessary? Yes,
definitely. Seek academic counseling, and then also let them know that you are interested in pharmacy school, and so that they can help you with getting those prereqs fitted in, as well as your classes for your major.
Okay, awesome. All right, so that was my last question for you. So we're going to kind of shift gears, and we're going to look at the questions that some of our viewers may have for you, and then I'm going to ask you those questions, okay?
Okay.
All right, so one of the first questions that we have, I hope that it also shows up on your screen.
Oh, I see.
One of the first questions we have is, how long is pharmacy school generally? What depicts the duration of each program? What is your program 3 years? Because it is accelerated.
Yeah, so pharmacy school generally is a 4-year program. And so my program, which is the 3-year program, is definitely accelerated. It just means we're year round. And so I basically don't have a summer. Yeah. So
Oh my goodness, I hate year round.
I don't have a summer. We do still have breaks, but then the breaks are very short. It's only like a few weeks long. And so, if you are the type of person that's very like fast paced, like you could keep going, UOP is definitely the program for you. However, if you like to like take things slowly, maybe like a 4-year program will be better. But then like even in the 4-year program, I know that like they do things a little bit differently. For example, I know the one in Clovis right now, they do their IPs during the summer break. And so that's also one thing to consider too. Like for ours, sorry, so IPs is kind of like a hands-on like work too. And so you're required to do those hours while in school. And so it's like an introduction to like the field of pharmacy. And so you're still like working as like a pharmacist, but you're like more learning instead. And so that for us, we do that during our semester. So we're taking class as well as doing those hours, whereas like other schools might do it during their breaks. And so just that kind of thing, like every school again too is like different in their curriculum and how they do how they have their schedule set out. And so it just depends on which school you want to go to.
Okay, so I know you mentioned Clovis. So now that you've mentioned Clovis, I'm thinking to myself, so could somebody attend pharmacy school inside of Fresno? Instead of, Fresno Clovis area, instead of, going out of the city, if they, they're afraid of, traveling long distance because they've never done that before?
Yeah, they definitely can. They definitely can. Again, it's just like, it's up to them. Like if they like the school and they want to stay at home, that's okay too.
Okay, that's nice to know, because I didn't know that there was a pharmacy school here, because I hear people talk about it, but I hear them talk about going to pharmacy school out of this area. So I thought that we didn't have any pharmacy school within the area. So that's really good to know.
Yeah.
The next question I'm going to show, the person asked, I know people who are pharmacy fearing it is all about numbers, remembering drugs, side effects, and adverse reactions. Any tips on succeeding with the above, or is this a misconception of pharm school?
So it is a lot of memorization. It really is. But the thing is that when it comes to like the side effects and the adverse reactions, that comes from learning about the drugs and its mechanism of action. And so it gets, at first, like it does seem like it's just a lot of memorizing with the numbers and the drugs names and like the side effects. But you go into depth, like being in pharmacy school, you go into depth on how the drug works, and it starts making sense. It starts making sense, like why you have like dry mouth when you're like taking a certain kind of drug. It's because like these receptors that causes you to start having saliva, like it's turned off. So like just that kind of things, like it starts making sense. And so eventually you'll get it, and it's kind of just like secondhand nature, like it just comes.
I like how you answer that question, because I have that same misconception that, oh man, it's kind of like math where you remember, all these equations and names and numbers. But it's a good thing you said that, because I mean, when you do really learn something in depth, the whole idea behind it, I think that's when you really, you become more passionate, and that that's what you really want to do. So I like that you said that. So then anybody who has a misconception like I did, it's good that you said that, because now I'm like, oh, it could be something that we could really enjoy. So I'm glad we have one more question. Okay, the next question asks, how do you feel about pharmacists becoming primary care providers, and would you be interested? Do you see pharmacy moving towards this direction soon?
So so pharmacy is actually moving towards that direction. Like I don't know if people realize, but then being in a pharmacy, like we can now give immunization shots. And so that's something that just kind of came in not too long ago. I am glad, like I do like the way that I like the direction that pharmacy is going. I think that it's giving us more what's the right term? More provider status, I guess. Because like I feel like in the past, like we've never really, like we were just pharmacists. Like they don't, like a lot of times, like people don't really see us as a healthcare provider. Like we're just someone, the pharmacy counting pills and like giving patients their like medications. Yeah, but then like we could actually do a lot, and I'm really glad that like we're going towards that direction because like we're actually like the pretty, let's just say a lot of people can come to a pharmacist and get service from a pharmacist with no cost.
Mm-hmm.
Yeah.
Okay.
And I don't think like people ever really thought about that. But then like, just coming into a pharmacy and like just talking to a patient, like it's so easy to do. Whereas like going to a doctor's visit, like you have to wait, you have to like make a schedule, and just being seen by the doctor, like you're having to pay co-pays and like, like all that like financial stuff. Whereas like a pharmacist, like it's free of charge. If you have a cold and you want to go and grab some medications for a cold, like it's so easy to go into a pharmacy and just talk to the pharmacist, which is a healthcare provider as well. And so I just I just like that we're finally kind of getting the status that that pharmacists should have been having. And so I'm excited, and I can't wait to see what the future has, the near future. Yeah.
Okay. I'm gonna give you two more questions just around the same question that just came up. Can you just kind of clarify to some of us and the viewers what a primary care provider is? And also, we know that like a doctor, they go through different courses, they do different like school stuff, different from pharmacists. So if some doctors believe that pharmacists aren't qualified to be primary care providers, right? So can you tell us what primary care providers are, and what are some qualifications that pharmacists have so that people can trust that I could go to pharmacists and not really someone who's licensed as a doctor?
Yeah, so the pharmacist, okay, actually let me answer your first question. So a primary care provider is actually, so a primary care provider is actually a doctor. And so the difference between a doctor and a pharmacist is that the doctor diagnosed the patient. So we're not technically becoming primary care providers, because pharmacists, we don't have the I'm sorry, like the words are just like coming out of my head right now. I can't think about anything.
Okay.
But like we're not able to diagnose patients, so we can't technically become primary care providers. But what we can do is we can look at the patient's like charts and labs, and ensure that the meds that they are on, the dosage and the medication is correct for them. And so I think like nowadays, like we're able to work more hand in hand with like with the doctor, which is the primary care provider, and like come up with a better like treatment plan for the patient. And so I'm sorry, I forgot your second question.
I think it was something along the lines, what some qualifications that the pharmacists have that, what qualifications do you think pharmacists have that would convince people to see them also and trust them, and not be just doctors who are licensed?
Yeah, so the thing, so pharmacists, we're the drug specialists. So our specialty is the drugs. It's the medicine, the medication. And so when it comes to like diagnosing, like we do get a little bit of that while being in pharmacy school. we do get a little bit of that. And so if we know what is wrong with the patient, we know the best medication for the patient. It's just that the doctor is the ones that has to do the diagnosing, and that we are the one that helps the doctor find the best medication for the patient. Yeah.
I agree with you. Now that I'm just kind of thinking about it, we always see pharmacists as someone. So we go to the doctor and then, we tell them, oh, we're sick. I have this symptom, and then they write me the note, and I go to the pharmacist and I see them behind the counter counting pills, like you said, right?
Yeah.
And then they'll come later, consult us.
Can you hear me?
Oh gosh, it just went out. I can hear you now. Can you hear me? We're
Yeah,
still good.
I can hear you. Okay.
Oh goodness.
Yeah, sorry, I kind of lost you there. I didn't hear what you were saying after like just a few bits.
Oh, I was just saying that I agree with you. I just think it's a good idea because, we have the idea of the pharmacist always being behind the counter, And so now that I think about it, it's probably a good idea when I think about it, it's like to have the doctor and the pharmacist there, and just kind of tell them that, hey, I feel this way, I feel this symptom. And then you being the professional in medicine, maybe you can tell me, well, this medicine helps to do this and do that. So I think that's actually a really good idea. With that being said, working alongside the doctor, do you guys need to be licensed in order to do that?
Yes. So you need to be licensed, and you also again have to like do the residencies.
Okay. So without the residency, there'll be like at like pharmacies like Rite Aid, CVS, Walgreens, and stuff like that.
Yeah. Yeah, but even being in like the community pharmacies, that's what we call them. Yeah, so being in the community pharmacies, there's still the pharmacist is still able to talk to the physician and give them advice on like which medication will be best for a patient. So let me just kind of give you guys a brief like description of what occurs in the pharmacy. So what happens is the prescription gets filled and then it goes to the pharmacist, and the pharmacist checks the medication, make sure that it's the right one, and then look at the dosage and make sure that it's correct. It's like a correct dose for that patient. And so, for example, for pediatrics, for kids, their dosage is smaller, is based on your weight, whereas like adults, the dosage is a bit different too. And so the pharmacist looks at that, and there's a lot of times where the pharmacists do have to do an intervention where they have to call the doctors and just let the doctor know that like, hey, like you prescribed this patient with the wrong dosage, like I think you're gonna have to like change it, you have to fix it, or like maybe the doctor didn't see that this patient was like allergic to like this medication and the doctor prescribed it. Like the pharmacist is the one that like does like the confirmation, basically confirming that that is the correct dosage, the correct medicine for that patient. And so like we do a lot of like the behind the screen work, and I feel like there's not a lot of appreciation for pharmacists, but hopefully in the future there will be.
Yeah, that's really good to know. Sorry, kind of ran out because I had a naked kid trying to run in. So, all right. So it looks like we don't have any more questions from our viewers. So I'm just going to go ahead and spend the last 5 minutes to ask you one last question that we do have. As always, I want to close the interview with a question about being a Hmong woman. So if you could just describe for all of us what it means for you to be a Hmong woman and what advice you would hope to instill in other Hmong women.
I think that So I know I've thought about this question a lot too.
Hmm.
I think that being a Hmong woman really just depends on your self-identification, and um, I I am no where to say that like, okay, being a Hmong woman, you have to be like this, or like you have to have this kind of qualities, or be able to speak Hmong and stuff like that. Like definitely it's nothing like that. Just for me, like being a Hmong woman is just basically being myself. I self-identify myself as a Hmong woman, and um, whether it means that like I could speak a little bit of Hmong and not that well, like that's okay with me. Like um,
Yeah.
I just I just want to like tell all the other Hmong women to like be yourself. Don't ever feel that you need to live up to expectations, like to the expectations of like someone else. Um, just do you.
Yeah.
Just do you and be yourself. And yeah, like again, being a Hmong woman, there's no definition to it. Like it's so like just being Hmong is diverse in itself, So yeah, just keep doing you. If you are just know that like we're all in our own path, like we all have our ups and downs, we all have our own struggles, and so just keep doing you, and like keep persevering and keep going, and you'll be fine. That's how my
Yeah.
life is. Yeah.
I love what you said. I love something that you said that really stood out to me because I know we're not going to focus this interview on being a Hmong woman, what it's like with the struggles and all that, but I feel like,
Yeah.
there's like a set definition for being a Hmong woman. And so I love how you said that being a Hmong woman has no definition. And I agree with
Mhm.
that, right? So like you said, just be yourself and you define that. So I love that. So
Yeah.
um, thank you, Susan. Do you have any last remark you would like to share with everybody else?
um I just want to say that if you're passionate about something, go for it. I know that coming, being here where I am today was a long and hard journey
Hmm.
too. I know we didn't really go in depth with that, but I did have there was a lot of times where I failed. And so one quote that like I always kept with me was that failure is temporary, and um, failure is only temporary, but giving up is forever. And so I've always kept that with me, and I think that that quote has allowed me to like always pick myself up, like
Hmm.
to never give up. And even when I fell, like I just kept going. And so yeah, hopefully it does the same for everyone else too. Like there will be hard times. It's not an easy road. It's not easy road even for like the smartest person, even for the hardest working person ever. Like
Yeah.
there will be the ups and downs, and so do expect it, but just don't ever give up, because you'll definitely get where you want to be. The pieces will fall
Hmm.
together. Yeah.
Definitely. Yeah. Thank you so much. Now that you mentioned that, I realized I guess I skipped the question where I wanted to ask you the challenges you had, right? But thank you for saying that, because that's a great advice, and I love the quote that you just shared. So thank you so much for that. Our interview has been going on for an hour, Kate.
Mhm.
So it's time for us to close, and I just want to say thank you so much for joining us. I learned so much from you. I'm hoping that my friends who want to go into pharmacy school will learn from you as well, because not going to pharmacy, I just learned so much from you, and so it's amazing. Thank you for being honest with us, giving us your time, and being here with us. So thank you so much, Susan.
Thank you, Linda, for allowing me to, speak to. Again, like I'm always open to any questions, and so if anyone has like any other questions, like feel free to like hit me up. I'll leave Linda with my email and my contact information, so that you guys can like always come to me for questions. And if you're in the process of applying, good luck to you, and hopefully we could work together soon too. So yeah, thank
Okay.
you so
All
much,
right. Thank you so
Linda.
much. I'll see you again. Bye.
Yeah,
Good luck.
definitely. Okay, bye.
Okay. Bye, everyone.